The month of March is Colorectal Cancer Awareness Month, and today we're very pleased to have in our studios Dr. Joshua Nachemson, who is with the Lehigh Valley Physician Group and performs general and colorectal surgeries. Thank you so much for being here. This is a very important subject that we're bringing up today. So tell us why we should not only be concerned about the month of March for this, but all year long.
Well, thank you, first of all, for having me, Lisa. Yes, we like to stress and emphasize in March that colon cancer is a fairly common cancer in this country. It's predicted about 150,000 people each year will come down with colorectal cancer, and nearly 50,000 people may end up dying from this. So it's a big problem, and it's one of the few cancers we can actually do something to prevent people from getting. And so that's why we stress the importance of screening, and we make a lot of effort to educate people on this type of cancer, the fact that it's preventable, and what needs to be done to make people healthy.
Is the key to catch it early? Is that what makes it preventable?
Well, absolutely. If you catch any cancer at an early stage, it's far more treatable. But really, in this situation, it's even possible to prevent people from even getting cancer in the first place. And we have screening tools to do that now. And what happens in the colon is people will form little polyps in the colon. Polyps are precursor lesions to cancer. So if we can find polyps in the colon before they even turn into cancer, we can prevent this type of tumor from forming in the first place, and that's really our goal.
So now, when we're telling people to get screened, what type of screenings are out there, and who should get them?
Well, most people have probably heard about the dreaded colonoscopy. It's where we use a camera and look at the entire large intestine. So that's still probably the gold standard in this country, but for certain people there are alternative screening modalities, some of which are non-invasive. There are some stool-based tests that can be performed that check the bowel movements for abnormal tissue or blood that could raise concern for possible polyps or cancer. So there are multiple modalities, but still the gold standard is probably the colonoscopy. With respect to who should get screened, well, certainly people who have a strong family history of colon cancer. If you have a first-degree relative, let's say a parent or a sibling who's had cancer or even polyps, that would put that person at higher risk, and so for sure they should get screened, maybe sometimes at a very early age, sometimes going into their 20s or 30s. Other people have certain types of conditions involving the GI tract. We call these inflammatory bowel disorders, colitis, Crohn's disease. Those patients are going to get screened at an earlier age. But for the average individual who doesn't have a strong family history of colon cancer and has no symptoms that would be concerning, such as bleeding or a change in bowel habits, the age at which we recommend getting a baseline screening exam used to be age 50, but now they've recently, within the past few years, have lowered that to 45. One of the reasons is because we're seeing an increase in colon cancer in younger Americans, which is a little bit concerning. So the age at which we initially recommend screening has lowered accordingly.
Is there any correlation to this type of cancer and our diet?
So there's a lot of information out there about the potential risk factors for colon cancer, and yes, there are what are called modifiable risk factors. Diet certainly plays a role. It's thought that diets higher in red meats, fats, certain types of smoked foods seem to be higher risk or correlated with higher risk of colon cancer. Certainly obesity, a sedentary lifestyle, lack of physical exercise, are also modifiable risk factors, and also excessive alcohol use and smoking. So all of these things shouldn't be surprising, are higher risk for not just colon cancer, but other types of cancers as well.
And I know you said, like, people that dreaded colonoscopy, it's not as bad as we think it is, though, correct?
Well, it's For most people, it's better than they think it's going to be. That doesn't mean people would willingly get this if they didn't have to. I had my colonoscopy last year, and it wasn't that bad. So it shouldn't prevent someone. The test itself shouldn't prevent someone from getting screened, because it's a lot easier to do a colonoscopy than it is to potentially do a surgery to fix a cancer once it forms.
So for people watching this right now, what's your best advice to them? Maybe they've never had a colonoscopy, or they're wondering what age they should do it to. What is your word to them?
Well, again, I would make sure, especially if people are seeing a primary care physician on a regular basis, that you discuss with your primary care physician what the appropriate screening tests and ages are for any given person. But like I said, for the average risk person with no symptoms or family history, should really start thinking about getting some type of screening done beginning at age 45.
So again, take the doctor's advice. The month of March is known as Colorectal Cancer Awareness Month, but definitely something we should be thinking about all year round.
Absolutely. Thanks again for having me.
Our pleasure. Thank you so very much, Dr. Joshua Nachemson.